Hello, this is Dr. Gay from First Look MRI, and this is a 51-year-old female with complaints of foot pain, no injury. And on this view we see a couple findings. Number one, her tibia-talar joint. This is the tibia up top. It ends, and below that we see a rounded area here. This is the talar dome, and this is called the tibia-talar joint. If we go off to one side of the tibia-talar joint, we see an area of darkness right here. This is part of the lateral talar dome. There's a small defect here. We call this an osteochondral defect because it involves the articular surface cartilage and the subchondral bone. So right here, this little dark area is the osteochondral defect. You can zoom that in up here. It involves the articular surface. There's no loosening, no displacement. We can see that in another view here. And this one you can see that there's some bright signal beneath the articular cortex there and a halo of edema, but just a small osteochondral defect. These are very common. They can cause pain and cause an ankle joint effusion. So that's one finding. But there was one other finding here, which we can see on this view. Down here there's an abnormal, anomalous articulation between this bone and this bone. Let's try to figure out what those are. Let's slide this one back here. And this is a T1 weighted image. We should see this a little bit better here. This is the navicular bone, and this is the cuboid bone here. And where they come together, we have this broad anomalous articulation, sort of a rare coalition. It's not an osseous coalition because the bone doesn't go across, but we could call this a cartilaginous coalition or a fibrocartilaginous coalition because there's cartilage there and maybe fibrous tissue, but there's no, again, ossification across. There's also another one over here. Let's put up the sagittals to look at the anatomy a little bit better. So here's a sagittal again. There's that osteochondral defect of the talar dome. Here's a calcaneus. Very commonly we get a coalition between the calcaneus and the navicular bone right here. And we can see that there is sort of a broadening between these two. Usually there's a little gap. Here there's not much of a gap. We only see on one view where they touch each other almost, but it looks like maybe a calcaneo-navicular coalition. But if we go one more cut over, we see really the coalition is between the cuboid bone and the navicular bone. Here's the navicular, there's a cuboid underneath it, and we can see that it's in a cuboid-navicular or navicular-cuboid coalition, which is, again, more rare. We'll look at this one more time on an axial view to see what it looks like here. Now in the axial view, it's very hard to see because we're slicing through it longitudinally. Here is the navicular bone here, and if we go along the plantar surface, this is abnormal. This part is really broad, and then this is the cuboid bone, so it's right here between the cuboid and navicular bone, but very hard to see on this view. One last look here, a coalition between the cuboid bone and navicular bone, which is very rare, and thank you very much.